still scattered. I mean, we cannot wrap our heads around anything. I mean, it's just super hard to watch.
7-week-old Ostara Clure is one of at least 20 kids hospitalized with COVID in our state. Those numbers as of Monday. The infant from Nampa was fighting for her life at St. Luke's Children's in Boise, but things took a turn for the worse, and she was rushed to Salt Lake City yesterday. She needs ECMO. That's a treatment giving COVID patients on the brink of death the best chance of survival. I interviewed her mom the day before Ostara was transferred. Things have obviously gotten very chaotic since then. Mom told me Ostara suffered a code blue and her oxygen tanked this morning, but she is stable now. From their hospital room in St. Luke's Pediatric Intensive Care Unit on Tuesday.
Right now, she's kind of going off the walls, and it gets more and more traumatizing.
Carli Valentine felt exhausted, defeated.
We're just trying to let her get better, but things have been going up and down.
She can't believe her baby girl's life.
I can't. I really can't.
Yeah. Started out this way.
There's no connecting. There's no enjoyable moment. Just a small baby. And I mean, she shows us how hard she's fighting, but it's still just hard to watch and be here every day and see how hard she has to fight.
A week ago, their life spun into chaos.
Thursday, our daughter got diagnosed with COVID and pneumonia.
At 6.5 weeks, Ostara woke up struggling to breathe. They took her to the doctor, where she was then rushed to the ER with a spiking heart rate.
Trying to get an IV in and trying to get a bunch of blood tests done, and all I could do was sit there and cry. I couldn't breathe. I just cried.
Mom and Dad have stayed in this hospital room around the clock for a week, away from their other 2 little ones.
Before, I didn't believe in the whole COVID. I mean, I didn't do the masks. I didn't do anything. And now, it's affected my daughter. It's affected my kids. My other 2 kids came up positive. It's affected all of our family around us. It changes all of our beliefs about it and how scary it really is. Because now we're worried about every single person in our family while worried about, our daughter who's fighting for her life with it.
Ostara can't breathe on her own, and her heart, lungs, and hydration levels are so bad, she's on oxygen and IV fluids. St. Luke's Children's System Medical Director, Dr. Kenny Bramwell, says Ostara is one of the worst COVID patients they've seen.
And she actually got worse over the first few days and got moved from our pediatric floor to our pediatric intensive care unit. And then she continued to get worse despite maximal therapies and different types of ventilators.
That's when her PICU team decided to transfer her to Salt Lake, where she could get a cardiopulmonary bypass called ECMO. Bramwell says Boise isn't a big enough city to have this advanced COVID treatment for kids.
So this is certainly a very heroic measure for a very sick 2-month-old child. And I'm hopeful that it will be of help.
In line with national trends, health and welfare data shows more Idaho kids are in the hospital right now with COVID than at any other time during the pandemic, fueled by the Omicron surge.
We're seeing, as young as 2 weeks of age, up to age 17, over and over. We know that statistically speaking, children are a small percentage, somewhere around 1 or 2% of all the patients who need to be admitted to the hospitals with COVID nationwide.
Dr. Bramwell says we can't just focus on those numbers, though. Children can get multi-system inflammatory syndrome weeks after infection, suffer from debilitating long COVID, or spread it to vulnerable family members. Bramwell says the absolute best protection is to get vaccinated, especially because our youngest can't yet.
COVID, we feel at almost all ages, is largely preventable with community and families being vaccinated. In many cases, it's incumbent on the parents and the siblings and the grandparents to do all they can to protect little sort of helpless infants.
Unfortunately,
it's real. It's life-changing.
It's too late for Ostara.
Definitely be careful. Do the hand washing. Wear the face masks. Do whatever you need to do to protect yourself.
I don't think you can choose to not get this anymore. I think you can only choose how ready you are for when it hits you.
The family asks you to keep Ostara in your prayers as she continues the fight of her life at just 7 weeks old. The family also started a GoFundMe to help with rent, food, and gas while they're in the hospital. Obviously, Carli and her boyfriend can't work or afford these climbing medical bills. And even if Ostara does get out of the hospital, they'll have an extremely long road of recovery ahead. If you want to help the family out, we'll have a link to their fundraiser in this story on ktvb.com shortly.